Hello, I'm Greg Jamian, and welcome to Home Health Care Corner. As more people receive their medical services and care at home, there are many questions that pop up that sometimes require quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work, along with answers to common questions found in home-based care. I hope you find the following information helpful.
My name is Lisa, and I'm a registered nurse with the Mira staff located in Troy, Michigan, and we're here today to talk about CPAP machines. With me today, I have Corey. He's our technician at Sun Medical, and he's the one that sets the machines up in the home. And we're going to be talking to Corey, and he's going to tell us all about how to set up the machine, clean the machine, and the proper use and storage for it. CPAP machine, the abbreviation stands for Continuous Passive Airway Pressure. It's a machine that's used to, a non-invasive treatment that's used to treat sleep apnea, which is more prevalent these days because of our increase in medical technology that's able to diagnose it. So in order to get a CPAP machine, you would need a diagnosis from your physician. And then you would be sent to a sleep study. So there's a process in being diagnosed. You just can't go to a DME medical equipment company and purchase it. So with me, I had already introduced Corey, and Corey not only is the person that sets these up in the home, but he also has sleep apnea and is a CPAP user himself. So Corey, with that said, can you tell me how you came to realize that maybe you needed a CPAP?
Actually, my wife is the one that told me I had it. I snored a lot, extremely loud. She told me that I stopped breathing. And from there, a couple days later, I called my primary care physician, went into him and told him my symptoms. And he gave me a prescription to take to a sleep study doctor. Then I went for a sleep study to a lab, and from then on, I've had my CPAP machine. And it's something that doesn't work overnight. You got to continuously use it night out to see the results of it. And I mean, it's a disease that a lot of people don't know that you have until you get tested for it.
Did your doctor tell you what, if you didn't use your CPAP machine, what could happen? What some of the, what it could do to your body?
What it does to your body, it runs it down. You think you're sleeping, and when you wake up, you're extremely exhausted. And that doesn't go away. It just gets worse. Mm-hmm.
And worst case scenarios, I know the sleep apnea during the night can also lead to a heart attack because of the loss of oxygen. So with using the CPAP at night, do you feel better,
I feel revived.
Energy?
I feel like I have a lot more energy, and I know 6-7 hours of sleep. I'm good for 12 hours, 14 hours.
Okay, good. So you had to get a prescription from your doctor, and then did you take that to a DME supply, medical supply?
Yeah, you could do 2 ways. You could take it to a DME supplier, or you could have the sleep lab fax it over to your choice of where you want to choose. But, if you know somebody that has a CPAP, word of mouth, well, you go to wherever you want, but word of mouth, you could take it to their place or wherever you want to go.
Okay, and did your insurance cover that?
My insurance did cover it. Yep.
Great. So Corey's gonna show us today how to put on the CPAP machine, how to clean the CPAP machine, and he's just gonna explain any other suggestions that he can give you about placement of it and proper fit.
Okay. I'll instruct you on the on the CPAP machine. This is a DS260 with C-Flex. This machine has a lot of options on it. This round button right here, this is what turns the machine on and off. This little button right here is a ramp button, which just starts at a low pressure. And if you set the machine, you know, the doctor will tell you set it for 10-minute ramp, which means if you're on 10 centimeters, it'll start at 4 or 5 centimeters and work its way up to full speed in 10 minutes.
Should you ever adjust that without the doctor telling you, giving you the...
You should never adjust anything. If you feel like you're not getting the proper amount, then you need to get back into your primary care physician and talk to him about other options.
Okay.
If they need to up it. As you can see here on this side, there's a water chamber. This is to keep your nose moist. Some people don't like it on, some people love it. You could have it on 0 or you could have it all the way up to 5 to keep your nose nice and moist so it doesn't, you know, dry out on the machine.
And what do you put in there?
Distilled water. You take the tray out. There's a little lip right here. Push it towards you. And then you're going to fill it up to the line. Okay, don't go over the line because it'll come out the back end of it and then it'll get all over your machine. When you get the water in, put the lid on. Take it in, then just slide it back in. And then properly press it down. You're going to put your CPAP tubing on. And then you're just going to start the machine. Okay?
And how would you put the mask on? How do you start?
There's different type of masks. Depending on what you have in your sleep study, is majority of the time you're going to get for your home use. They make a full face, which this is a full face. They make a nasal mask, and they make a nasal pillow system. The best way that, I found out how to put the mask on is, we're going to take it off. The best way is, when you put it on, you could always undo the straps on the bottom, leave the top on, put it on your nose. Well, this is a full face, so it's going to cover, okay?
What do you do in the morning if this chamber still has distilled water in it?
The chamber normally keeps the water, I say 3 to 4 days. Some last longer, some last shorter. Don't get worried if it stays in there longer than normal. When it empties out, you're going to take it out. You're going to take it out of the unit here, and you're going to wash it with warm soapy water, rinse it, and let it air dry for the day. Okay, and then nighttime, fill it up with distilled water. Okay. Once a week, you can put 3/4 cups of water and a 1/4 cup of vinegar. Doesn't matter what kind of vinegar. Rinse it, soak it for about 20 minutes. Rinse it and let it air dry. Okay. And as you can see over here, Lisa, we have many products. These are normal household products that you could have in your house. You clean it. A mild dish soap like Dawn, distilled vinegar, white vinegar, distilled water, and for the mask itself, you could purchase these CPAP wipes to sterilize the mask.
And you can purchase those at the same location where you get your machine from,
Yeah,
right?
you could purchase these at the same location you got your machine from.
Okay. Well, that's great information, Corey. Again, if you have any questions or you're just feeling tired, run down, you don't know why, it would be very important for you to get into your primary care physician who can further diagnose you with sleep apnea if that need be and get treatment for it. So, Corey, thank you so much.
Thank you.
For being here today.
Yep.
Thank you. If you have any further questions, you can call Amira staff at 248-288-2270. Thank you.